Connecting with Pets, a Forever Vets podcast.
Hey everyone, and welcome back to our second episode of Connecting with Pets. So today we're going to be talking about pet obesity. And we are here with Dr. Sydney Orr. She graduated from the University of Florida, and she has been with Forever Vets for a little while now at our Tinseltown location. And we're just going to kind of delve into the world of pet obesity, health risk, how to keep your pet healthy, and things like that. So Dr. Orr, what is considered obese?
Hi there, I'm happy to be here. So I would say obesity is, kind of a fluid term, and I think it can definitely mean different things to different people. So I always kind of tread the conversation lightly because I think I never want to hurt anyone's feelings by saying, their pet is overweight or obese. But at least in my opinion, I would say when we're using the term obese, it's usually when we're talking about a grading scale, I would give them like a 7 out of 9, 8 out of 9, or 9 out of 9 on my body condition scoring. And so that's usually when we can kind of tell that, we're not really palpating or feeling the normal structures that we expect to, and we have a little bit more fat or a lot more fat kind of covering some of those structures that we are used to seeing on the body.
Okay, no, that makes perfect sense. What are some of the long-term health issues that come with obesity? You hear about joint pain sometimes, but I'm sure there's way more issues that are underlying.
Yeah. So I would say some of the biggest health concerns that we can see with obesity, definitely diabetes mellitus for dogs and cats, heart disease, hypertension or high blood pressure. We also actually can see higher or increased risk with anesthetic complications. So, anesthesia always comes with risks, but I would say it's an increased risk if we know that the patient is overweight.
So if they're going in for surgery or anything like that and they're more overweight, there's more likely to be complications.
Exactly. And so we always do preoperative blood work panels just to make sure we don't have anything else going on. But even just being overweight alone sometimes can cause some anesthetic issues. The other things that it can cause too is we can get a lot of early osteoarthritis and some early onset degenerative joint disease as well that we can see in pets when they're overweight. Just, carrying that extra weight that they're not normally used to can definitely cause some wear and tear on the body. And sometimes treating arthritis can be a bit frustrating because it takes a while and sometimes it's not a perfect fix.
Wow, okay. So going into that, with those health issues, what can pet parents do to help combat, obesity? I know you see a lot in older pets, they get more treats, more love, but that does lead to that weight gain and everything like that. So what are some tips that you would potentially suggest?
So one of the things I always explain to people, kind of like I had mentioned before, we use this body condition scoring scale, and some doctors use different scales. So there's a 5 scale or a 5-point scale. There's also a 9-point scale. So usually with those scales, I always kind of like to explain them to people just so that they understand a little bit more what they mean. So when we're using those scales, we usually look for a number right in the middle. So if we're using a 5-point scale, I like to see a 3. If we're using a 9-point scale, I usually like to see a 4 or a 5 out of 9. And so one of the things I'll usually do with clients is I'll show them what I like to see and what makes me give a patient a 4 or a 5 out of 9 because I use the 5 or the 9-point scale. And so I always explain to them, we want the ribs to be felt with our fingers if we press on them, but we never want to see their ribs through the skin. That usually means that they're too skinny. If we don't see the ribs and we don't feel the ribs, then we start to know that there's a thicker fat layer on the ribs that's making it a little bit more difficult to feel those. The other things we look at, the same kind of topic when we're looking at the spine, we should be able to feel the spine when we press, and we should be able to see the pelvis or those hips, or we should be able to feel them. So if we're not feeling them, again, that means that we have too much of a fat layer, and then we're also losing that abdominal tuck that we like to see. So those are always at least the things I tell people to look for. And then once we realize that we are overweight, some of the things that I will have them do is we start off easy. So I always like to start off with something non-drastic, unless it's truly a health concern. So I'll usually say, let's eliminate treats from the diet and let's eliminate table scraps.
Mm-hmm.
So I think a lot of clients love to give, extra food that wasn't finished at dinner,
Mm-hmm.
or as they're making dinner and they've got an extra piece, rather than throwing it away, or if it fell on the ground, they let the dogs eat it. And so those are the first two things I eliminate.
Mm-hmm.
Some owners are very sad because they love giving treats. So I'll usually recommend things like carrots or green beans, because
Mm-hmm.
those are lower calorie treats, higher fiber, but they still feel like they're giving their animal something.
That's good to know. I was gonna say
Mm.
I'm guilty. I know my dog loves carrots,
Oh, yeah.
so I occasionally give those little
Yeah.
table scraps every now and then. So that's really good to know that those
Yeah.
are like the first two things to
Mhm.
kind of like take action with. That's very, very good to know. Like we were talking about treats and everything like that, eliminating table scraps. How important is diet versus exercise?
Yeah. So, I think I would say that exercise and diet are equally important,
Mm,
but I do think, at least I'm guilty of it, and I'm sure a lot of veterinarians are as well, that we tend to focus more on diet restrictions and reducing the amount of food and things like
mm-hmm,
that, only because it's very hard to discuss exercise to the extent that we can reach each client. So,
mm-hmm,
we never know lifestyle, we never
right.
know work hours and things like
Mm-hmm,
that. And so some people aren't home with the correct hours to be able to do, 20 to 30-minute walks and frisbee and, throwing a tennis ball and things like
mm-hmm.
that. And so while that's amazing and I love to recommend it, it's just not always feasible for every client. So I think that that is also why we tend to, in addition to recommending exercise, we give decrease in food recommendations as well, just so that we can kind of make sure that we're covering both bases. But I definitely think exercise is a huge part of weight loss.
No, that makes perfect sense. The diet is more accessible, more
Exactly.
feasible for people versus the exercise. And that makes perfect sense. As far as I know, our topics have mainly been centered around dogs losing weight. I feel like with the
Yes.
exercise and things like that. I know at Tinseltown y'all see exotics. I'm not sure if y'all ever have any overweight rabbits or anything like that. But for cats and dogs, is there a difference? Say somebody has like an overweight cat. Is there a
Yeah.
difference in their weight loss plan
Yeah.
versus what weight loss plan you would give a dog?
So there's definitely some differences. I
Mm-hmm.
would say I still recommend eliminating treats, eliminating extra food, and I also recommend decreasing the amount of food that we're feeding. So
Mm-hmm.
with dogs and cats, I always say we want to feed them for what their ideal weight is. So, you have a 80-pound dog, you want them to be closer to 60 pounds. So we feed for 60 pounds.
Mm-hmm.
In cats, it's usually a smaller scale of weight that we have to lose when we look at the overall body weight. So in a dog, it's a 20-pound difference. And so it's going to take a while, but they have a lot to lose. Whereas in cats, when they only weigh 16 pounds compared to that huge dog,
Mm-hmm.
when we want them to weigh 9 or 10 pounds, it's only 6 pounds, but it's a huge percent of their body weight. And so what we usually say in cats is it's very important to make sure that while we're decreasing all of that, we want to make sure that they're still losing weight at a slow, gradual
Mm-hmm.
flow, just because we don't want them to lose weight too rapidly. So, about a pound per week is pretty good. In cats, it could even be a little bit less. Half a pound to a pound is healthy.
Oh wow.
So the biggest things that we worry about in cats, especially with weight loss, is if they are not eating enough food or if they stop eating because we've tried to switch them to a healthier or lower calorie diet, they can actually get some serious health concerns. One of
Mm-hmm.
them is colloquially called fatty liver disease,
Mm-hmm.
also known as hepatic lipidosis. And so that happens, and it can be pretty serious in cats if they stop eating or if they have a drastic decrease in food. They can get pretty upset with their GI tract and their liver. So we always like to warn people, never feel like you need to have cats lose weight really quickly.
That's a great point because I know some people, they hear, oh, my pet's overweight, they might have health issues, and they might try and take like a drastic approach. And what is your recommendation for somebody trying to start their pet on that weight loss journey?
Yeah, so once we already know that we've eliminated treats and we've eliminated the people food,
Hmm.
usually the next thing I'll do is ask them to decrease the amount of food that they're feeding by 20%.
Okay.
And so for some people, I think they get a little confused by that because, most of their animals are ad lib or free feeding.
Hmm.
And so they don't really have a schedule yet. And so once the bowl is empty, they just refill it. And
Hmm.
so these animals are kind of used to just eating whenever they want to, and they're
Hmm.
not really getting that full hunger feeling. And so I always ask them to start on a twice a day feeding schedule. If you can do 3 times a day, great. The smaller feedings more frequently are really good for them. But we always try to do at least twice a day. And with that, I always say make sure that we're using an actual measuring cup so that
Hmm.
we know how much we're feeding and we're not giving those heaping scoops of, 1 cup, because a heaping scoop then turns into more than a cup and then we're
Right.
feeding more than we think we are. And so I always say once we start measuring our food, that'll be easier for us to know what percentages we can decrease that amount.
No, I know I was guilty when I first got my puppy and we just had like a cup. We were just scooping and we're like,
Yep.
this looks right. And then we got an actual, while we were waiting for our supplies to come in, we got that actual measuring cup and we were like, oh my goodness, he was like eating so much. And now he's like the actual correct amount for his age and weight and size. So I definitely recommending getting that measuring cup makes such a huge difference in their feeding schedule. I definitely think so.
Yeah. I think sometimes that's the biggest thing for people, I think, is just realizing we're probably feeding more food than we think that we are.
And I know, like with the fur babies, they're always gonna act like they're starving and hungry, but when they're being fed on that regular schedule, you have to remember, oh, they did get their food today, they did get their intake. They're just
Yeah.
gonna act hungry because, you
Yeah.
know, if they see good food, who's not gonna want good food?
Yeah. I think sometimes it's food restraint in animals, but it's also letting the owners know that even if we're acting starving, if we've gotten our meal and we know that we're consuming the right number of calories,
Hmm.
it's okay. We can wait until dinner.
Right.
If you need to, we can totally give some carrots, some green beans, some healthier treat options to make them feel like they're still getting treats as well.
No, that's such a great tip, getting those healthy treats, because I know my dog does not know the difference between a veggie and like actual like fatty treats, because
Yes.
he loves everything.
Yeah.
So those carrots, I feel so much better giving him carrots versus, all those other store-bought treats and everything like that. So that's a really good point. So, if somebody wants to start their pet on their weight loss journey and they haven't been to us, so like your first recommendation, obviously, always talk to a vet. Get potentially blood work done if that's needed, but just always consult a vet before, starting that food decrease and everything like that.
Yeah. So I think that's a big thing too. We talk about all of the issues that can come because of obesity,
Mhm.
but there is actually a couple of things that obesity can be a clinical sign of. So
Mm.
that's why we always recommend if your pet is overweight, definitely come in and at least let's do some blood work. Because sometimes in overweight animals, especially in dogs, we can start to think about things like Cushing's disease or
Mm-hmm.
hyperadrenocorticism, where the body is producing too much cortisol. Another one is hypothyroidism. And
Mm-hmm.
so with hypothyroidism, we can see a decrease in the amount of thyroid hormone. And so sometimes that can lead to animals that I feel like the clinical history is always, we're on a feeding schedule, we're doing exercise, we're not giving treats, and I feel like he's really not that hungry, but we can't get him to lose weight. That's
Mm.
always something that kind of sends our alerts going that we want to check some blood work and see what's going on. And then with Cushing's, like I had mentioned earlier, we always see certain things like increased drinking, increased eating. And so
Mm.
with Cushing's, we start to see animals that are overweight, but they are ravenous. Like they're always hungry no matter how much food you give them. And so that's another reason why we always want to check blood work
Mm.
because yes, we could just be obese and we're overfeeding, but we also could have some health issues as well that we need to address. And then that might help us decrease our weight as well.
That's a really great point, because I know some people might come in and be upset by, oh, they're just recommending me blood work for whatever reason, but it could be a major underlying health issue. So that's a really great point to make.
Yeah. And I actually wanted to circle back too. So when we were talking about the differences with dogs and cats, something interesting with cats that are obese is when we talk about diabetes mellitus as one of the potential issues we can see with obesity, I feel like that's especially true in cats. So diabetes mellitus is in cats, it's more similar to people type 2 diabetes.
Oh, okay.
So in dogs, it's more like type 1. But in cats, when we talk about type 2 diabetes similarities, it's usually due to overweight or obese cats. And so the reason being, they start to develop insulin resistance. And so when we notice that they're starting to get overweight, that's why we're so adamant that we need to see if we can decrease that before we get things like diabetes mellitus. And so in cats, if we can get that weight down, we might prevent it. But if we are diagnosed with diabetes, if we can get that weight down and we're giving insulin, we can actually sometimes reverse the diabetes.
Oh, wow.
And we can get them into a remission.
Oh, that's so amazing that that's even possible.
Yeah, it is. It's not always forever. Sometimes it's temporary, but we can get at least a few months out of the remission as long as we can get these cats to lose that weight.
Right, get back to that healthy weight. That's amazing.
Very cool.
I did not even know that was possible with cats. That's insane.
Yeah, it's really incredible.
Well, thank you so much, Dr. Orr. If you had anything else to add, do you have anything else?
I don't think so. I think I just always like to urge people, I think sometimes when we tell you guys that your pets are overweight, I know that it can seem like a personal attack, and I swear it's not. We are really just looking out for the best interests of these pets, and I never want it to feel like we are criticizing you or your pet parenting. We know you guys do a great job. We are just looking out for the animal and trying to make us as healthy as possible.
No, that's a great reminder for all pet parents out there. Might be diagnosing your pet with an underlying health issue, might be preventing long-term health issues. You see the chubby puppies and the chubby older dogs, and you think, oh my goodness, so cute, but there really might be some health issues later down the line, and preventing that is so important.
Yeah, absolutely.
Well, thank you so much for coming on and talking about this. Dr. Orr does work at our Tinseltown location, so if you're interested in a first free office visit with us, you can give us a call, and she will be glad to see your pet. Thank you so much.
I can't wait. I look forward to seeing you guys in the future and hopefully being on the podcast more.
Thank you so much.
Awesome.
Thanks everyone for listening. We are Forever Vets, locally owned and operated in Jacksonville, Florida. Visit us at forevervets.com to find out more about our community events, monthly promotions, and more specifics on animal care. Don't forget to catch our episode next week.